Hello everyone, welcome to sqadia.com, and in this section we will talk about the treatment of subfertility. First we will talk about ovulation induction, then we will talk about laparoscopy and intrauterine insemination IUI. Ovulation induction. Ovulation is very important. Without ovulation, there is no ova production. So in case if there is no ovulation, so it is stimulated by the medications that leads to stimulation of the ovaries to produce ova. So stimulation of ovulation by medication, and that stimulation cause stimulation of the ovarian follicles. More follicles are produced, and more follicles produce more ova. This is done. Ovulation induction is commonly done in cases when the patient has an ovulation or oligo-ovulation. An ovulation means no ovulation at all. Oligo-ovulation means scanty ovulation or not enough ovulation, not enough healthy ova are produced to cause pregnancy. So these are the conditions in which ovulation induction is important. So this medicines which cause stimulation of the ovaries, it cause release of oocyte or ova from the ovarian follicles. Sometimes these medications can lead to hyperstimulation of the ovaries and multiple ova are produced. In these cases, when ovulation induction is done by medicines like clomiphene and gonadotropins, multiple pregnancies are very common. So triplets, quadruplets, all quadruplets, these are common. So you see females with 3 children, 4 children, 5, all these are common with the clomiphene citrate and tamoxifen and gonadotropin, because they cause stimulation of ovaries and more 4, 5, 6 mature follicles are formed and they release mature ova. Here if you see in this picture, the stimulation is done starting on day 3, 4, 5, 6, 7, 8, 9, 10. There is injection of FSH is given. And then on day 11, just before ovulation, HCG is given, which is human chorionic gonadotropin. That causes mature follicles to release the ova. And that ova is then used for intrauterine insemination. So, induction of ovulation by the medicines. Then laparoscopy is another procedure to find out the cause of infertility. This is the direct visualization of the reproductive organs to find out if there is any abnormality, if there are any masses, if there are any fibroids, if there are any septums in the uterus, if there is endometriosis. All these you can directly visualize by putting the laparoscope through small hole into the abdomen, and then you can see all these structures. And direct visualization can help us to find out if there is any actual cause leading to the infertility. Then IUI, intrauterine insemination, is the procedure in case of in females who have thick mucus that protects the sperm from reaching the ova. This is very commonly done in that case. So more sperms can reach the ova to fertilize. So in this intrauterine insemination, sperms are directly placed into the uterus, so they have direct access to the ovum. Indication is mainly in case where there is a low sperm count and low mobility of the sperm, if there is unexplained infertility, if there is thickening of the cervical mucus. These are all very common indications in which intrauterine insemination is done. So after the ovulation is inducted, at the time when the ovulation is taking place, washed sperms are injected into the uterus. Here you see there is a direct injection of the sperm into the uterus, so they can overcome all the hindrance in the cervix if the mucus is thick, or if there is any abnormality or problem in the vagina or cervical opening. These can directly enter into the uterus and cause fertilization of the ovum. So, at the time of ovulation, when induction is done, after the 24 to 36 hours after luteinizing hormone surge, when the level of LH is high, surge really high, 24 to 36 hours after that, ovulation takes place. So that's the time when IUI or intrauterine insemination is done by putting the sperm into the uterine cavity to increase the chances of the fertilization of the ovum. So that was about the two very main treatments of the subfertility: ovulation induction, laparoscopy, and intrauterine insemination. Thank you for watching sqadia.com.